Canada's universal healthcare system is something that's celebrated worldwide, but experts say not everyone is treated equally. I'm Faiza Amin in front of the Women's College Hospital, where experts say a health gap in the system means many women are overlooked and underserved.
I think we're only really starting to recognise the very significant gap that there is in healthcare.
Women's College Hospital says the health gap is evident throughout the medical field. Some facts they cite include women are more likely to report severe and long-lasting pain, but typically get treated less aggressively than men, and they're more likely to get referred to a therapist instead of a pain clinic. Also, the mortality rate for heart disease is improving for every demographic group except for young women. The hospital says for decades and decades, the health sector has had a one-size-fits-all approach when it comes to research, diagnosing and treating patients, and women's experiences are disproportionately left out.
There are a lot of differences between men and women. Whether it's physical or whether it's the social and ethnic, etc., issues that all feed into healthcare. And then in women we have this whole effect of the changes in our hormones over our lifespan.
Women are often overlooked when it comes to conducting health studies, even though they have different risk factors and respond differently to treatments. As women enter different stages of their lives, they become more susceptible to heart disease. But even though heart disease kills more women than men, researchers say many cardiovascular drugs that have been on the market for a long time have only been tested on men.
We were researching diseases, diagnostic techniques and treatments in men and not in women. In male animals and not in female animals. And it's really only been since the 1990s that we've started to think, well, women are actually different, they're physiologically different.
Why have we been slow to get the research done?
Well, it has been considered that studying women is more complicated than studying men. Studying female animals has been considered more difficult than studying male animals because we have these hormones that affect the diseases and treatments.
Women's reproductive phases are also under-researched, including during their pregnancy years, due to concerns of harming the baby.
We have a long way to go. We've started this sort of path, but it really is important for any of the different health conditions that we all may experience across our lifespan.
And as you can see by this banner, the Women's College Hospital is also tackling the health gap. To learn more about what actions they're taking, you can head to our website, citynews.ca. In front of the Women's College Hospital, I'm Faiza Amin for City News.